Not with behavior manipulator, physical manipulator. So get to lie down and face that way. Your head could be like on your tummy, on your stomach. On your stomach, good. And then you can do just down, a bit more down, and then your head a bit more that way. Like that, okay? Slightly down a little bit more, just a little bit more. Good, okay. Now this hand, I'll show you both sides, okay? And then we can talk. Do you have, would you mind taking this off? Is that okay? Because otherwise we want to see what we're doing. So we're doing that, and then rotating to the same side. So what you want to do, don't think about too much now what's gapping, what's not gapping. Just I want to show you how you lock the joint first. So the neck is in neutral or in a bit of extension, okay? Now have a look, this fingers in front of the chest a little bit, can you see that? So the contact will be through the spinous process. So what I do is roll and lift the head. Can you see that? What happened to the neck? I rolled and come up, boom, to here. See, I de-rotated her. Did you see that? So the head, if you don't see the head is lifting, that means you're not doing the right thing. You should see the head coming up. So so skin and coming across to the bone, that's it. Can you see that? Mm-hmm. All right, so really we'll like you to practice like 4 times one side. Or show the other side, so if you turn the other way, so then this arm is up. I'll come here. Okay, with this one, guys, I just need a bit more space. So for this, what you want to do, you want to lift and rotate that way. Can you see that? So really that way. And you see, I'm almost gonna be, so get a bit of extension, a bit more extension. Drop your head in. So what you want to do, you want to come up here and then de-rotate. See my elbow is vertical, so then you apply a bit of a tension through here. Can you see that? So I'm applying a bit of tension, but I'm not doing anything. And from here, and then do that. Okay? Right. And it's a speed, not a force. Okay? So you see, so just a little bit of tension, and it's a speed. So it's not forcing anything, it's follow through. And that's why with the lumbar, it's a follow through thing. So come on the other side. How did it feel to you? You're in shock. But was it painful?
Can't speak.
Not painful. Yeah, because it's comfortable. So what I do with this, I kind of just come up to here. No, just relax, don't do anything. I come up and you see I hold that. Now this, I can come into extension a bit more. Good. So come up to there, yeah? And from here, I don't push here at all. I just feel that end point. And then
So the main driving force is your right hand.
it's my right hand. And the key thing is here, that is like a pistol. Pistol across.
Okay.
It's like a pistol across.
If you don't want to manipulate, you can do a mobilization. Can you do it?
You can do sitting what we just done. Exactly the same, you don't have to do this. So the one which is done, perfect. You don't have to do that. But some people can, they like it. They like it, some people want to manipulate it. Some countries love it, some countries hate it. Whatever, it depends on the person. And if you've got that kind of stiffness, sometimes the gapping or manipulation can be quite effective, So what I guys want you to do before we do this, I wanted to show you this first thing. It will take time. And we'll show another manip, it will take time. So just to plant the seeds. Plant the seeds, practice. So, so you can stand up for me. You can lie down. I'm not going to manipulate on you. I just want to show you what it feels, what it looks like, and what manipulation. How does it feel if you turn the head now from side to side?
Here.
Better. Because just before I have some restriction on the right side cervical rotation, but it seems it's a bit better.
Good.
Can he do here?
Huh?
So Because of
No, you
that.
cannot. Because it's a hole. That's the reason we're doing this. It has to be flat. Yeah. I wouldn't do just, not to show you, there's a purpose for that. Take it, if you take a shot for me. So I'll just show you the locking now. So don't worry guys, I'll just show you the locking. And the ones who maybe at the front, maybe change with people who can't see. Maybe you guys, the ones who you haven't seen, if you want to come in more at the front, kneeling or, so just, yeah. So maybe you could shuffle down a bit more. Yeah. So this hand down, and this, turn your head other way. All I want you for now, guys, to try to do is just locking the joint, or like putting the tension. So all I want you to do is, see this hand, the fingers go underneath, so my thumb is almost flat like that. Now I come through here and I lift and I derotate. And from here I just feel the tension. And that's all I want you to do for now, to be honest, nothing else. So you lift and see that the head is moving. And just then feel pushing the head oblique, that you feel the tension, that's it. So really so you're derotating and a bit of a tension through that.
Whereas what level did you go to on?
C7, T1 or T2 you can do, yeah. And of course you can do a couple levels at the same time. Sometimes it happens, not only one level, when you gap. And on that side I'll show you again. So if you turn your head away and then look that way. Yeah, so but the key thing, look, yeah, so we'll build up because a lot of, you need to feel that. Now you see I come on top of the patient a bit and see my fingers coming at front of the chest. And from here I lift up and I derotate. Just relax, yeah, derotate. And then you see I'm coming on top. Now, elbow, if your elbow is here, the force is that way, you see? We want the force that way. So it's really coming through there, and then sustain that a bit. That's all, just coming on top, and then letting go. So 4 times one side, and locking, 4 times the other side, and change. And then reversing 4 times and 4 times. But we're here coming back. If you're struggling, don't worry, we'll just keep doing it.